So hello everyone, thank you for taking the time to be here with us today. The format today will be the same as in previous town hall gatherings. I'll talk briefly about our organization. We'll then take a break, and then you'll have a chance to write down any questions you have for me or any members of the executive. And then we'll take the last 20 minutes or so to answer those questions, okay? Today, I'm going to talk about the results of the WHA engagement survey. I want to talk about mindfulness at St.Amant. I want to give you an update about where we are in the goals of our strategic plan. And then I want to take you on a little journey into the future to have a look at our organization once the strategic plan is complete. I do, before I get into all of this, want to highlight a few celebrations. One is I do not have to answer any questions about when are we going to embrace recycling within this building, because we have. Yes. So thank you to all of you, you know who you are out there, who helped make this happen. Really appreciate it. I also want to let you know our St.Amant Cafe has been reopened with a new menu. I was wondering if that was my phone going off there, Peter. We have a new menu, and we have a new catering menu. And I'm also to remind you that the menu is posted on the website a week in advance, in case it's not available down here. We also have some staff moving to the new space that we've acquired on Moore, and that's happening in early to mid-May. That allows us to then proceed with making some other moves for people within this building that we hope, I think I've spoke to in the past, will make everybody happier. We also have Share Vision. That's currently the demographic information is being entered for all the people we support. This is a huge first step in this project. Another few celebrations. First, the St.Amant Foundation raised $1.22 million over the past year. I'd like to share a video that the St.Amant Foundation, thank you. The video you're going to see was shown on Saturday morning at the donor breakfast. It highlights some of the good work that the foundation has funded, and also the hard work of many projects that are happening here at St.Amant, such as the leisure guide. So I'm just going to pause, show you the video, and then we'll continue on.
The feedback from parents has been wonderful. A lot of parents said that it's starting to fill in the gaps. The children are really enjoying it. They look forward to coming every week and trying new activities. A lot of their goals are being reached. It's just been an overall fantastic experience.
Having something in our area has been amazing, and it's just something that just makes him get out of the house and feel more kind of like a regular little kid.
every day. I go on it for 40 minutes and I'm losing weight. Thank you.
Thanks. The Leisure Guide has been a really big success. I know that there are some glitches that need to be worked out, but that's to be expected with anything new that we try. As Wayne Gretzky said, you miss 100% of the shots you don't take. I expect with the new initiatives, there will be challenges, there will be missteps, and we will learn and move forward together. Progress is not made by staying stagnant. So thanks to everyone who's played a big part in this project. From volunteer services to staff on the living units, developmental services, and the many, many volunteers who make it work. Thank you. In the fall, I believe I stood right here and asked each and every one of you to complete the Winnipeg Regional Health Authority Engagement Survey. We've received the results, and I have to say I'm not surprised by the feedback, and I'm actually encouraged that we're focusing our time and energy on the right places. 517 people, or 33% of our staff, filled in the survey. I'd definitely like to see us have more people fill the survey in next year, and I'm very open to your suggestions on how we can encourage and facilitate staff to do that. The survey indicates that our total engagement score is 61%. Now let's talk for a minute about what we mean when we say employee engagement. Engaged doesn't mean happy. Engaged goes beyond happy to an employee who is committed beyond just getting the job done and taking home their paycheck. An employee who is engaged cares at a deeper level about the overall goals of the organization and is committed to helping in any way that she can to meeting those goals. An engagement score of 61% is good. We have one of the highest scores in the region. For example, some of the other scores, the WHA as a whole was 56%. Action Marguerite was 54%. Deer Lodge was 54%. And Misericordia Health Center was 65%. The survey gives us reams and reams of information that can be broken down by work group, etc. However, the themes that emerged were the same throughout our organization. The top areas that were identified as needing improvement are removing barriers to productivity, such as work processes, and providing appropriate resources. Other areas, managing performance, career opportunities, and recognition. As I said before, these themes were not a surprise to us, and in fact, were identified in our strategic plan through the Leadership Excellence priority. We are continuously looking at ways to improve our processes. Some of the current projects that we're involved in involve Quadrant, which is our payroll and scheduling system, the development of ShareVision, which I already mentioned, access to computers for all staff, access to my St.Amant intranet from home, and looking at how information flows throughout our organization. I know we still have a ways to go in removing barriers and ensuring that our resources are maximized, and you have my commitment that we will continue to look at processes and efficiencies throughout the organization. Managing performance, enhancing career opportunities, and improving recognition. This really does fall within the Leadership Excellence Project Plan and has been a goal since the development of our new strategic plan. Basically, through this project, we are focusing on training our leaders in the areas of coaching, change management, and conflict resolution. As far as recognition and career development go, We also have in the works a review of how we do performance appraisals, and will actively be training managers to work on development plans with their staff, helping them to grow where they need to in order to be successful in the next step of their career. Overall, the results indicate strong job satisfaction, confidence in senior leadership, and a positive view of St.Amant as an employer. So although I talked about how we want to improve and the steps we're going to take to get there, we have a lot to be proud of. Big thanks to all of you who completed the survey, and we will definitely work on how we can ensure more people are able to complete it next year. And just so you know, this was our first year in participating in that engagement survey. So before we move on to the strategic plan updates, I want to talk for a minute about Mindfulness initiative here at St.Amant. We've been doing some pilot projects over the past year and offering different kinds of training, all the while working on a project plan for how to make mindfulness meaningful and relatable and tangible as a goal for all of us. Our St.Amant values remain the same, and we're committed to those values now and in the future. Those values, just to remind us all, are collaboration, hospitality, excellence, and respect. Mindfulness will help bring our values into everyday practice. I believe, if you can see the screen, are we just in the process of putting up a poster, or also referred to as an infograph, talking about the 3 different branches of mindfulness here at St.Amant, and I'm going to specifically address those now. So we have direct service, employee interactions, and wellness. Direct service is every interaction that we have with the people we support. It means that we are giving our full attention to the people we support, making conversation and being conscious of the effects of our support. Employee interaction means our interaction with each other, giving our full attention, listening more than talking, and participating without judgment. These first 2 were really clear. They're non-negotiable. They are an expectation here at St.Amant. It's part of our culture. The last one is wellness. This is a commitment that we are making to you. We believe that personal wellness, relaxation, and learning to be present is beneficial for work, but overall, it's beneficial to yourself as a whole. The offerings in the personal wellness area are not mandatory, but are recommended and are here to support you. This goes for the individuals that we support as well. We want to have a toolbox of options that are available for staff and for people that we support. Why is this so important at St.Amant? There is heaps of research to support the benefits of mindfulness, personally and in the work environment, and in the care and support of others. The goals of our mindfulness project are: we would like to have happy, healthy, supported individuals and families. We'd like to have satisfied, engaged, and connected staff. And we'd like to have healthy employees. So keep your eyes out for training opportunities and wellness initiatives in the coming months. Okay, there's an immense amount of work being done to move the strategic plan forward. You likely know about the projects in your area and know a bit about some of the others, but I'm going to list them all for you right now. It's actually pretty amazing, and it might seem like I'm going on and on. I am. There's a lot going on. Transition planning, offer for community options for people who live at River Road. The next year, we have a plan to move 15 individuals to the community. We are looking at expanded models of service for people that we're already serving through our community residential program. We want to provide a wider range of options for people served through the Autism and Outreach program. Some of the leisure guide activities are a good example of that. Expand service options for people served through our St.Amant school. We want to complete a refresh on one of our living units here at River Road and identify the next one to be refreshed. We want to continue to integrate recreation staff into the living unit team structure and increase effective use of volunteers in support of recreation and lifestyle activities. We want to renovate 1 or 2 units, either Ashview or Ashview and Cedarview, to be purpose-built stabilization units. For child and family services, we're implementing the rapid response clinical assessment. We are implementing, actually just started this project, 10 new beds in our emergency foster program. We want to complete a proposal and seek funding for increased respite services. We're looking at consolidating existing River Road Place respite beds, and I want to say excluding CRCS, onto one unit. Under education and training, we're establishing an employee curriculum that focuses on developmental and other related disabilities. We're reviewing, identifying mandatory training across the organization to look for efficiencies and opportunities for collaboration. We're revising our orientation and onboarding process. We're expanding the Mindful Touch for care providers training. We're developing new content for our web portal, new workshops for families and stakeholders that will be available through the web and on-site, here and off-site. We want to develop partnerships with the Manitoba Immigration Centre, Misericordia Health Centre, St. Boniface University, and school divisions. We want to develop new diversity training. We want to offer basic computer skills training. For our leaders and managers, we want to have 100% of our directors will have a 360-degree evaluation and development plan based on results. We'll identify and clarify expectations for senior managers and managers, and we're going to review the supervision model. We're going to develop professional development plans and succession planning, and a new orientation specifically designed for managers. We also want to develop a focused and deliberate and intentional communication plan with each priority as the project plans are created. All of these plans are happening and in various stages of completion right now. So what does this mean for St.Amant, for the people we support, and for you? Well, let's take a journey into the year 2020, so 5 years from now. I want to walk you through our services as I envision them once our current strategic plan and all of the projects that I just listed are complete. So again, let's step into the year 2020. Here we go. St.Amant currently employs over 2,000 staff and has more than 400 active volunteers. Our community clinic with medical and clinical expertise is located in a former living unit and is open to every Winnipegger with a developmental disability, and the feedback has been terrific. We're also celebrating our 1-year anniversary of our downtown community clinic, giving better access to more areas of the city. Giving the people we support better access to health care with a regular doctor and open community clinics improves quality of life and serves as a wonderful training ground for medical professionals to learn more about how to provide quality care to people with developmental disabilities. 2020, our leisure guide has grown tremendously over the past 5 years, providing activities for hundreds of people of all ages with developmental disabilities and autism. The program serves people across the lifespan for individuals from St.Amant as well. We've expanded it to hundreds of people from the community who found us through the Leisure Guide. When it was first started, the majority of the activities were at 440 River Road, and now we're in every neighborhood in the city. I couldn't be happier with the program. Some of the volunteers have been supporting the same individual for 5 years now. These new relationships have created more natural friendships and life experiences. St.Amant's new office space in the Exchange District provides a central location for autism programming in Winnipeg. Not all families can stay home with their tutors, and this location provides access to the same quality treatment our families receive in home. We have a strong service for complex medical needs, which provides a relief to hospital services in the city. This location sees shorter stays with the goal of providing as much care in the community settings as possible. Some of our nursing and medical staff now work on rotation, making regular visits to community homes for people with complex medical needs. Everyone at River Road has his or her own personalized room. The renovations to the living units have made for a modern home, more modern, home-like environment, allowing residents to host families and visitors just like they would if they lived in a home. We have 10 respite beds on site and have opened community options for respite as well. We have 20 new children that are now receiving great care from wonderful foster families supported by our organization. Our clinical staff are in regular contact with family services, providing rapid response assessments as children come into care, and we are also very busy in our crisis stabilization unit as beds are used every few weeks to provide a place for those that need a stable, safe place to be cared for while permanent arrangements are made. Our community residential program is constantly evolving to try different living environments based on individual needs and desires. There's never been more living options for the people we support. St.Amant community day programs are located in 2 areas of the city and provide communication, physical, social, emotional, and employment options for people. Many of the people we support have found paid employment and are more financially independent. Our web-based services have grown to include many different online courses and community forums. This has connected St.Amant to a network of families and professionals worldwide and has placed us as the go-to for innovative advice and best practice in the field of developmental disabilities. This is the vision of the St.Amant Board and leadership. As you can see in the future, St.Amant continues to work to improve the quality of life of the children and adults with developmental disabilities in Manitoba so they can reach their full potential. Our goal is still to provide supports to each individual and enhance choice and quality of life. All of the work that we are doing now, all of the change that can sometimes be exciting and sometimes be trying, is going to pay off in the end. I expect we will be providing services to many more people. I expect to be employing many more people, and I expect that our work will be changing lives for the better. Thanks for your time and attention this afternoon. There are question slips on your table. Please fill them out, and we'll be around to pick them up over the course of the break. So thanks, everyone, and we'll be back in about 15 minutes, okay? Thank you.